Good afternoon, all. On behalf of the Department of Panchakarma, Faculty of Ayurveda, IMS BHU, I welcome you all in this online guest lecture at Evidence-Based Panchakarma guest series, which we have started for the propagation of Panchakarma and knowledge sharing Panchakarma to all of you. And today it's truly an honor to welcome today's guest speaker, Dr. Sachin Chandaliya, who is a esteemed figure in the field of Panchakarma, particularly working in Nagpur as our distinguished guest speaker today. Dr. Sachin sir holds an MD and PhD in Panchakarma and is currently serving as a professor and head of the department in Government Shri Ayurved Mahavidyalaya, Nagpur. His doctoral research, a randomized controlled trial comprising Kutajadi Vamak Yoga and Madanadi Vamak Yoga is in the management A. Kukushta, reflects his deep commitment to advancing clinical practice in Panchakarma. Routinely, wherever I go, I've seen Dr. Chandaliya sir at demonstrating the Vamana and speaking about the Vamana. So his expertise in Vamana is really appreciable, and of course it will be very useful for all of us. Dr. Chandaliya sir has an accomplished academician with over 20 years of undergraduate and nearly 14 years of postgraduate teaching experience, and he has also contributed internationally as an honorary lecturer in Berlin. His dedication to academic excellence has earned his several accolades, including the gold medal by the Institute of Indian Medicine, Pune, and Best Teacher Award at his current institute. Beyond his teaching and research, Sachin sir has made significant administrative contributions, notably as NABH coordinator, PG in charge, and a key member of various universities and institutional committees. He has also authored several impactful books, including Everything About Vamana and Basic Principles Behind Panchakarma, enriching the academic resource in this field. His diverse achievements include multiple diplomas and certifications, extensive research work, and numerous national and international publications, highlighting his academic dynamic involvement in both clinical and academic Ayurveda. He has published more than 50 papers in research journals. Okay, so today we look forward to gaining valuable insights from Sir, vast experience and profound knowledge. Please join me in warm welcoming and inviting Sir for today's guest lecture. Over to you, Sir.
Thank you, ma'am. Thank you for your appreciating words, your kind and appreciating words. And good afternoon to all of my colleagues and students and PG scholars. Thank you, Rajkala ma'am, for inviting me to share my thoughts on Koshta Vichar in Panchakarma. So, not wasting the valuable time, I am moving towards the today's lecture, that is Koshta Vichara in Panchakarma. So, is it visible, ma'am? PPT. Can you share the PPT, ma'am? Thank you, ma'am. So, Koshta Vichara in Panchakarma. Topics to be discussed in today's sessions are Koshta Vichara, different thoughts. Next slide, please. Koshta Vichara from Sanshodhana point of view, types of Koshta, discussion regarding factors influencing Koshta. Next slide, please. Koshta Vichara, different thought. Then Koshta Vichara from Sanshodhana point of view. Then types of the Koshta, discussion regarding factors influencing Koshta, practical assessment of Koshta, developing scale or score for Koshta decision, analysis of Koshta in 101 patients, discussion regarding the probable working pattern of the Koshta and relation of the doshas, and conclusion. So basically, the purpose of today's lecture or today's session was to share my thoughts on the Koshta, because Koshta is the very important aspect while dealing with the Panchakarma. In every Panchakarma procedure, you have to think about the Koshta. As Charka says, Samikshani hi dosh beshaj desh kal vaya bal sharir ahar pratmya satmya vaisa maustantarani. So, apart from these 11 factors, one factor that is Koshta, which we generally assess in every Panchakarma patient, because the all the Panchakarma procedure deals with the Mahasrotas, that is Koshta. Vaman, Virechan, Basti and Nasya. Nasya, you can also say that it deals with the Koshta, because Koshta starts from the mouth itself. So, all the Panchakarma procedures are to be dealt with the Koshta thought only. So, regarding Koshta, there is an important aspect also. A lot of people think that Koshta is unchangeable entity, and it is also believed that it is concreted at the time of the decision of the one's Prakriti. But it's not true. We'll see it later on. And the fundamental, talking about the fundamentals of the Koshta. Next slide, please. The Koshta from Ayurveda perspective should be looked from both point of view. So koshta can be seen as anatomical entity or physiological entity. So most a lot of Ayurveda factors should be pursued in both the ways, anatomical as well as physiological. The context should be understood. So regarding koshta, the thing is also true. Anatomically or structurally, the meaning of the koshta is antara jataram or any one vessel of the body or the abdomen. So next slide, while moving to the references of the koshta, anatomically, we next slide, please. Next slide. References of the koshta are anatomically koshta said to be the group of the organs related to the thoracic, abdominal, and the pelvic cavities, and the physiological aspect helps in understanding the nature of the bowels. Physiological aspect is dealing with the understanding the nature of the bowels. So structurally, these are the three important aspects. स्थानानि यामग्नि पक्वानां मूत्रस्य रुधिरस्य च रुद् उण्डुकपुपसश्च कुष्ठ इत्यविधीयते said by Sushruta and कुष्ठपुनोच्यते महास्रोता शरीरमध्यं महानिम्नम् आम पक्वाशेचेति Sarogmargabhyantara and Panchadash Koshtangani. If you go through all these references, we will come to know that there are a lot of visceral organs which are nomenclated as a koshta. And from the koshta punauchyate mahasota sharir madhyam mahanimnam amapakvashayacheti. So starting from the mukha to guda, the whole gastrointestinal tract also can be considered as a koshta. So structurally, these are the broad. This is the broad aspect of the koshta. Next slide. Functionally, we see the koshta is a different way. It behaves in three different ways, based on which we classify koshta into three categories. I am not going into detail of the structural things and physiological functional things. We'll move to the main portion of our today's discussion is the mrudu koshta, madhyam koshta, and krur koshta. So mrudu koshta we consider as a soft vowel, madhyam koshta or madhya koshta we consider it as a moderate vowel, and krur koshta we consider as a hard vowel. Next slide. So how koshta are assessed or decided in routine? Practically, as we saw that koshta structurally has different visceral organs, but physiological or functionally, we decide the koshta based on the bowel habits majorly. When we deal with the panchakarma, whenever we talk about the koshta, it is always the bowel habit of the patient. So next slide, importance of assessment of the koshta, that is for the physicians of the panchakarma. There are some parameters through which, next slide, through which we see the koshta is as important aspect. Number one, as predicting or prognostic value. References from Vagbata, Durnamnam iti urdavartah paramo ayam upadravah vatavibhut koshtanam tairvinapi sajayate. So udavarta can occur in the patients of the vata dominant koshta. So if the patient is having the vata koshta and having the vata dominance, he may have the tendency or to get the disease of the Harsha. Next slide. For deciding the dosages, whenever you are dealing with the panchakarma and you need to decide the dosages, you need to see the nature of the koshta. Dravya pramanam tu yaduktam asmin madhyeshu tat koshta vayobaleshu. Three factors we need to consider while dealing with the dosages. Number one, koshta. Number two, vaya, and number three, bala. That is the strength of the patient. Based on this sutra, Sushruta says tatra mrudo matra mrudvi. So whenever the koshta will be the mrudu, the quantity should be mrud. Tikshna matra in krure. Krur koshta, you can increase the quantity or you can go for the bigger quantity, tikshna quantity, and madhya kartavya. So he's talking about the matra in aspect to the koshta. For next slide, for deciding the course of the panchakarma, whenever you are deciding any panchakarma course or sequence or any regime, you need to consider the koshta of the patient. Ruksha bhavanila krura koshta vyayama shirinam diptagninam cha vaishajam avirechya vijirvati. The patients who are having the ruksha koshta, provoked vata, krur koshta, doing excessive exercise, stimulated agni, if given virechan medicine, it will get digested without producing the effect. So before going for virechana, you should clear the kosta. You should have some mruduta in kosta by administering basti, snigdha virechana and tikshna phalvarti. So for deciding the course of the kosta, you need to understand for deciding the course of the panchakarma, you need to understand the nature of the kosta. For selecting drugs for the panchakarma, whenever you are selecting any drug for the panchakarma like virechana, you need to understand the cost of the patient. Just like Trivrudakhyam Varataram Nirapayam Sukham Tayo Sukumaresha Vruddhe Mrudu Kostecha Taditam. If you are going in a virechana in Sukumara, Shishu, Vruddha or Mrudu Kosti people, you need to go with the Trivrutta, the drug of the choice for the virechana. Next line, the effect of virechana drugs on the kosta. Okay, if you are assessing the effect of the virechana drugs, सुधा भिन्नति दोषाना महांतमपि संचयम अशोय कोष्ठ विभ्रंशात न एवतम ताम कल्पयता मृदो कोष्ठे अबले वाले स्थविरे दीर्घ रोगिणी कल्प्या गुल्मोदर गर त्वग्रोग मधुमेहेषु. So Snuhi quickly breaks down the bonds which are strong and firm doshas and weakens the kosta. Whenever you are using Sudha or Snuhi for the virechana, it weakens or it influences kosta very hardly and it weakens the kosta. So the patient who are having the mrudu kosta or abala or bala, bala or ruddha or dirgharogi, in these patients you should not use the Sudha drug. So whenever you are using any virechana drug, you should assess the kosta first. Next slide. For assessing vyapat or complications, if you are assessing vyapat, if you are giving basti and if you want to assess the vyapat of the basti, you need to consider while dealing with the basti. For that sake, or while dealing with the basti, every aspect of basti should be decided after giving thorough consideration to the kosta. Asnigdha svinna dehasya guru kostasya yojita शीतोल्प स्नेह लवन द्रव्य मात्र घनोपिवा बस्ती संक्षोभ्यतम दोषम दुर्बलत्वात अनिर्हरण karoti ayogam तेन. So whenever the patients having the guru kosta and not having the abhyanga and svedana properly, if given the basti shita and ghana with the ghana consistency, it may lead to the vibandha or ayoga. So all these are the things which should be considered by the physician while dealing with the panchakarma. So whenever you are deciding the dose, whenever you are deciding the course, when you are deciding the nature of the medicine which you want to give, you should consider the kosta. So how the nature of the kosta is decided? These are the 5 parameters by which we assess the kosta or we decide the kosta. Number 1, response to specific anuloma feed. As everybody knows, Mrudu kosta is said to be having the certain drugs. Whenever given, they produce the Mrudu anulomana. That is the first thing. That is anuloma. Duration needed for the completion of snehana. Right? Then, based on the response to the shodhana, dominance of doshas in kosta and quantity of kapha in kosta. These are the 5 major parameters on the basis of which kosta is decided. Number 1, response to the specific anuloma drug. This is very famous sutra. Tatra Bahupitta Mrudu Savirichati Kshira Ikshu Rasa Amla Takramastu Guda Krushara Sarpira Navamadhyoshnadaka Pilu Draksha Puga Faladi Api Bahuvata Kruraha Sadurviricha Trifala Tilvaka Tirut Nilini Faladi Api. So if you are giving Kshira or Ikshurasa, Takra, Mastu, Guda and the patient is, then you can say that the patient is having the Mrudu kosta. And if you are giving Trifala, Tilvak, Trivrut, Nilini, Fal Adi, if you are using these drugs and still the patient is not getting the virechana, you can say that the kosta is a krura in those patients. In Mrudu kosti patient, there will be the dominance of the pitta, and in a crude kosti patient, there will be the dominance of the vata. So, by watching or by observing the response to the specific anulomaka food, you can have the assessment of the kosta, the nature of the kosta. The second parameter is the duration needed for completing the snehana. Very famous sutra is there. Yecha snehati achchapanena prayasha tri sapta pancharatra iti. As Sangra says. Sangra says, Hindu says, yo achchapeya snehana tri ratrena snehati samrudu kosta saptaratrena sakruraha pancharatrena snehati samadhyati lakshanantaram. So if the patient is getting oleated or if the patient, the snehana of the patient is completed within the 3 days, the patient can be considered as a Mrudu Koshti. If the patient is taking 5 days, he should be considered as a Mrudu Koshti, Madhyam Koshti. And if the patient is taking 7 days to complete the Snehana, he should be considered as a Krur Koshti. So this is the second parameter for assessing the Koshta. The third, explained by the Hemadri. Hemadri says, मध्यमेन शोधनेन हीन योगी क्रूरः अतियोगी मृदु सम्यक योगी मध्यः संसर्ग सन्निपातजास्तु अवस्था पूर्ववत्. So after madhyama shodhana, if hina yona, if you are giving the shodhana of the madhyam type, and with that madhyama dose and madhyama drug, the shodhana is carried out, and if hina yoga appears, the koshta is said to be the krura. If ati yoga appears, then the koshta might be the mrudu, and if samyak yoga happens, the koshta will be the madhyam koshta. Famously, again, dominance of doshas in koshta. Koshtastu trivido bhavati mrudu kruro madhyascha tatra bahupitta mrudu bahuvata krura bahushleshma samadoshascha madhyaha. So based on the dominance of doshas, pitta, if the predominance of the pitta is there, the koshta will be mrudu. Predominance of kapha, vata is will be there, koshta will be the mrudu, and sorry, krura. And predominance of the kapha or samadosha condition, the koshta will be the madhya. Arun Datta explain the koshta in a different manner. He has quantified quantity of the kapha. He considers quantity of a kapha in koshta while dealing with the nature of the koshta. Kim krutva koshtam mrudu madhya kru lakshanam vibhajya vicharya श्लेष्माधिक्येन मृदुत्वम श्लेष्म मध्यत्वेन मध्यत्वम श्लेष्म हीनत्वेन क्रूरत्वम. Though it is contradicting to the original text of Vagbhata and Sushruta, he has the different opinion, so we should take the consideration of this sutra also. If the kapha is dominant in koshta, then it is to be considered as a mrudu koshta, kapha medium, madhyam koshta, and kapha in lesser quantity krur koshta. He has taken the Charka's Vachan in consideration. We'll see afterwards. And Yogvaitva of a kapha. This is the different aspect of the kapha. As we know, Vata is said to be Yogvahi. But while dealing with the koshta, there is a discussion regarding the Yogavahitva of a kapha. Okay, Bahuvata Shleshma Kurura, Sushruta says. So whenever there will be the dominance of the Vata and kapha in koshta, the koshta will behave as a Krur koshta. Why it is so? Because if the kapha is dominant in the koshta, the koshta will be madhya, as Vagbhata says. And here Sushruta is saying Bahuvata Shleshma Kurura. So why this difference of opinion? So Arun Datta is Hemadri is clarifying that. He is saying that Sushruta is quoting regarding the kapha is Bahuvata Shleshma Krura. So whenever the kapha is in samsarga with the vata, the koshta will be krura, and whenever it will be in samsarga with pitta, it will behave as a mrudu. So kapha here acts as a yogvahi as per Hemadri. Next slide, please. There is a beautiful discussion from the Arun Datta regarding the Madhyam Koshta. So we have a case now. Madhyam Koshta has 2 or 3 types of nature. Number 1, if kapha is dominant, then the koshta will be the madhya. Nanu samay vatadivi katam madhya koshtata iti. And in sama doshas condition also, koshta will be madhyam. So sama vatadivi katam madhya koshtata saditi. He is saying why koshta will be the sama in the madhya will be madhya in sama doshas condition. He is saying that opposite properties of vata and pitta neutralize the things. So kapha being balanced, next slide please. When kapha being balanced, sama adopts a neutral position between the two and does not offer or oppose either. So he's saying vata and pitta are influencing koshta in opposite manner, and if kapha is having the equal quantity as with the vata and pitta, it will neutralize them, the opposite properties of those 2 doshas, and it will move the koshta into the madhya direction. So sama dosha condition, koshta will be madhya. Kapha dominant condition also, koshta will be the madhya. So we have the case that Koshta has two, Madhya Koshta has two aspects: Samadoshit condition and kapha dominant condition. So how to differentiate in between the two? Shreshma Dike, the last line of the uh, Hemadri's Vachan, Shleshma Dike Madhya Koshtena Samyak Virichittatvam, Samakafetu Madhya Koshte Suviricitvam. So whenever there will be the Kapha Dike in Madhya Koshta, Virichan will not be Samyak. In a Sama Doshaj condition, Madhya Koshta will be there and Virichan will be the in a Suviricitvam. So it will be the smoother Virichan in Sama Doshaj condition. So why Mrudukoshti are having the sensitive gut? So Charka has explained, Bhavati Krurukostasya Grahani Tilbanalina Udirna Pittalpa Kafa Grahani Mandamauruta Mrudukoshtasya Tasmatsa Suricha Narasmata. So Mrudukoshti patients are having Udirna Pitta Alpa Kafa and Mandamauruta in the Grahani. Next slide. Grahani Koshtastha Agnyadhisthana Bhutanadi. So the definition of the Grahani says Koshtastha Agnyadhisthana Bhutanadi. Whenever you are talking about the Grahani, it is the Agni Adhishthana Bhutanadi, and the Koshta Grahani is inside the Koshta, right? So Krur Koshtasya Grahani Gato Vayu Gudadinam Saratvam Pratibadnati. Chakrabarti says, in Krur Koshti people, Vata will be dominant and it opposes the Saratvam of the Gudadi. In Mrudukoshti people, Grahanyam Virodoko Vayu Nasti, Stambhakopi Shreshmalpa. In Mrudukoshti people, there will be the dominance of the Pitta, Vata will be in a lesser quantity or absence of the Vata, and Shreshma will also be in a lesser quantity. Udbhuta Saratva Gunam Cha Pittam Prabalam, Ten Gudadili Sukham Virechana Bhavati. So in a Mrudukoshti people, Saraguna dominant Pitta will be Prabal and it will help in Sukha Virechan with the help of the with the drugs like Guda, Shira, and etc. etc. Next slide, please. So interesting things are regarding the Madhyam Koshta. Some interesting things are there regarding the Madhya Koshta. Next slide. Next slide, please. Only Vruddha Vagbhata has mentioned the 5 days duration for the Samyak Snigdha symptoms to be achieved after Acha Snehapana. Charka and Laghu Vagbhata has mentioned only upper and the lower limit of the Snehapana duration. So Madhyam Koshta is explained by the Vruddha Vagbhata in the context of the Snehana. While commenting on Charak Siddhistan 1, Chakrapani says that Sneha Prakarsha Kala for Madhyam Koshta will be the 5 days. Next slide. Both Vagbhata had mentioned that the Kapha Prakriti people, Koshta is said to be the Madhyam type or Kapha dominant people. Samadosha Prakriti or Samadosha, where the Samadosha will be there, the Koshta will be the Madhyam. Then regarding the quantity of a kapha, Madhya Koshta has 2 types, having kapha dominance, kaphaja, having kapha in equal quantity, samadoshaj. Arundhata says, Shreshma dominant Madhya Koshta, patient virechana will not be samyak, and in a samakapha Madhyama Koshta, virechana will be samyak. So discussing this, regarding that, conclusion is alone Vata in Koshta, naturally due to the Ruksha, Shoshane Ruksha and Shita, Sambhane Hima, halting the Virechana process, and lone kapha in Koshta also poses problem for Virechana. As Charka said, Shleshmottara Shardaiti Yadukkam Virichate Mandakapasu Samyak. So this was the discussion, theoretical discussion regarding the nature of the Koshta. So we have seen that dosha are the influencing factors which decide the nature of the Koshta. If there is a Pitta dominant, the Koshta will behave as a Mrudu Koshti, and if Vata or Kapha dominant, the Koshta will behave as a Krura one. But practically, now we'll move to the practical aspect of the today's session. Practically, whenever you are sitting in a OPD and you are asking the patient regarding the Koshta, you always think on the certain parameters which are related with the bowel habits. So these are the parameters. Next slide, please. Which are considered by the physician while dealing with the nature of the Koshta. First is the effect of the purgatives. In Mrudu Koshta, purgation occurs on consuming milk, jaggery juice, grapes, etc. It will happen in the Mrudu Koshta. In Madhyam Koshta, in the second column is the Madhyam Koshta. Sorry. First are the parameters. There are 9 parameters which we generally consider. Then in the second column there is the Mrudu Koshta, behavior of the Mrudu Koshta people. Third column, behavior of the Madhyam Koshta, and final column is the behavior of the Kuru Koshta. So effect of the purgatives in Kuru Koshta, there will be no occurrence of the purgation, and in Mrudu Koshta, purgation will occur with the milk, jaggery and jaggery juice. Bowel habits. In Mrudu Koshta, regular bowel habits are there, strong urge of the defecation and satisfactory defecation. And in Kuru Koshta, irregular bowel habits, more straining required, and unsatisfactory defecation. Then fecal composition. In Mrudu Kushta people, the feces will be the loose. Madhyam Kushta people, the feces will be formed stools, and in Kuru Kushta, hard stools are there. Time taken for the defecation. These are the practical aspects on the basis of which we generally consider the Kushta. Time taken for defecation in Mrudu people 2 to 5 minutes, Madhyam Kushta people up to 5 minutes, and Kuru Kushta people more than 10 minutes. Frequency encounters of the diarrhea and constipation. In Mrudu Kushta, it is very more probable, the probability is more in Mrudu Koshti people. Madhyam Koshti, not sure, and Kuru Koshti people, constipation may be frequently present. Whenever you ask the patient and the patient is saying that I don't go for the defecation for 2 or 3 days, I have to take the medicines for the laxative medicines like laxatives routinely, then you consider it as a Kuru Koshta. So frequency of the motions is also important. Recurrent history of getting distension in abdomen. In Mrudu Kushta people, there is less chances, but in Kuru Kushta people, they are frequently present. Time taker for Jirnahar Lakshana, digestion of the food will be faster in Mrudu Kushta people. In Madhyam Kushta people, that timing will be optimum, and in Kuru Kushta might be appearing late. Water intake in Mrudu Kushta people, more water intake is seen. Madhyam Kushta people might be having normal water intake, and in Kuru Kushta people, these people have the tendency towards the less water intake. And last, Satmya 2 types of the consumption of the rasas. Mrudu Kushta people might be consuming more amounts of the Amla, Lavan and Katu rasa. Madhyam Kushta people might be consuming same quantity of all the rasas, and Kuru Kushta people might be taking the more amounts of the Katu, Tikta and Kashaya rasas. Next slide, please. So, I tried we tried in Panchakarma department to standardize the Koshta. There is always a question how to decide the Koshta. Everybody is having different opinion and different scales for deciding. So we try to decide the Koshta on a scale. So we name it as a Koshta deciding scale, KDS. So methodology was adapted, like 100 patients were selected. A clinical proforma was prepared based on the 6 major parameters, which we discussed 9. Out of them, we chose 6 A detailed questionnaire was prepared to assess the parameters clearly to avoid the ambiguity. These were the 6 parameters. Next slide, please. Which were taken in consideration. Number 1, frequency and consistency of stool, effect of taking hot milk, hot water, etc. at night, passing of the stool usually. 4th one, time taken for the defecation, that is excluding the time of the for newspaper, mobile reading, etc. Feeling of the urge for the defecation, 5th one, and 6th one, history of the disease related to the stool. These are the 6 parameters which we considered, and this is the next slide. This is the chart, actual chart I am presenting in front of you. Next slide, please. This is a chart which we generally assess for the assessment of the Koshta. You can see there are 5 columns. First one is the serial number. Second one is the parameter. Kindly keep this slide only. Second one is the parameter, and next 3 columns are of the Mrudu, Madhyam and Krura. So just one has to just tick the things, and there are the marks given in the brackets. Like in Mrudu Koshta, unformed 1 to 4 times a day, 7 marks are there. Formed or soft Pinda Swarup 1 to 2 times a day, 3 marks are there. Formed and hard Grathita Kadak Ruksha, alternate day or more than 7, this is 7 marks are there. So every parameter has been given the scale or the marks, and after calculating the ticks, the total number of the marks are to be calculated, and based on that you can decide the cost of the person. This is the simplest way of deciding the Koshta. So we have made it very simple, or the objective for deciding the Koshta by filling this. For example, this is the next slide, please. This is the same pro forma. Please, the next slide. Koshta field form is there. No. Previous slide, previous slide or previous slide. But skip this slide. Okay. Here you can see the patient came with the patient was having the we asked the patient the frequency and the consistency of the stool. It was Pinda Swarup. Then effect of taking the hot milk or hot water, there was no effect, right? Then we talked about the time taken, 5 to 10 minutes. Filling up for the after defecation, that was 20 minutes after waking up. So these were the ticks, and he was having the history of the fissure also. So I put the 3 marks over there. So by calculating this, the Madhyam Kushta, it was all the ticks were calculated, the marks were calculated, and it was decided the 15 was the score. So automatically the Koshta becomes the Madhya Koshta, and we can move in that direction. Next slide, please. Next slide. This is the format in which we are taking this. So you can kindly see this format again. That the table, please. Keep the table, please. Previous slide, huh? Just see the scales in the bracket. You observe, because based on that only we can decide the Koshta time. Like the fourth parameter is the time taken for the defecation. In Mrudu Koshta, if 1 to 4 minutes are there, 5 marks are given. 5 to 10 minutes, 3 marks are given, and more than 10 minutes, 5 marks are given. Likewise, you tick the things and you decide the Koshta. Next slide, please. So decision of the nature of the Koshta, final conclusion is when, next slide please, when the KDS for the, next slide, when the Koshta deciding scale for Mrudu Koshta is 12 or more than 12, when the scores of the Krura and Madhyama are below 12, the Koshta is said to be Mrudu. When KDS is for Madhyam Koshta, when it will be 9 or more than 9, it will be called as the Madhyam Koshta, and KDS for Krur Koshta is 12 or more than 12, automatically it will be the Krur Koshta. So, Mrudu Koshta. So, out of 101 patients, we found, next slide please. These are the, again the same thing, serial number. These are the K2, K5, and serial number K2, K. You can see K2, K5, K6, K8, K9, K11. This is the serial number of the patient. We collected this is the chart of the Mrudu Koshta. We found 47 patients having the Mrudu Koshta. And you can see the first row where the K2 is written. In Mrudu Koshta, there is a 19 the score, and the parameters which were ticked are written in the bracket. Third, fourth, and fifth parameter was present in them. First and second parameter was from the Madhyam Koshta for the patient, and if 0 parameter from the Kuru Koshta. So the score we calculate after that. You can see the 5 parameters are being covered in Mrudu and Madhya. Out of that, 3 parameters were for Mrudu and 2 parameters were for Madhyam. So by calculating the totals which were in the bracket, the score for in the Mrudu column was 19 and Madhyam column was the 6. So based on that, we decided that Koshta will be the Mrudu. Now you see the scores of the scores in the Mrudu Koshta column. 19, first is the 19, second is the 19, third is the 14, 14, 14, 19, 14, 26. These are the score which are drawn after calculating all the parameters which were in the column of the Mrudu Koshta. So points deciding Mrudu Koshta, score was 12 or more. Point number 3 and point number 5. Now you can see that green column. So first point out of 47 patient. First point was in 14 patient, second point was 8 patient, third point was found in maximum 37 patients, and fifth point was found in 35 patients. So 47 patients were having Mrudu Koshta. in which third and fifth points were more in quantity. In Kuru Kosta, again 17 patients were found to be having the Kuru Kosta. Again same thing. Next slide, please. Next slide, please. Okay. In Kuru Kosta also, you can see the Kuru Kosta column. Now see the scores. 20. Sir, Kuru Kosta. Previous slide, please. Previous slide. Previous slide. Yes. Now you can see in the Kuru Kosta 26, 21, 28, 33, 14. The Kuru Kosta 14, 12, 33, 21. These are the scores of the Kuru Kosta people which were obtained from the chart, and the total patients were 17. So nature was the Kuru Kosta. Now next slide. Out of that Kuru Kosta people, yes, 15 were 15 patients were having that frequency and consistency of stool more in more quantity, and fifth feeling of the urge for the defecation was late in those patients after 20 minutes after getting up in the morning. So maximum patients show the first and fifth number points. So they were the major points which decide the nature of the Kosta and the Krura. Next, Madhya Kosta. Next slide, please. Next slide, please. Madhyam Kosta. Next slide, please. So this is the previous slide. Previous slide, sir. Previous slide. Bas. Thank you. 37 patients. Remaining 13 patients. Next slide. Only bas. This slide, please. Keep this slide only. Now you see the middle column of the Madhyam Kosta. N is equal to 37. So 37 patients were of the Madhyam Kosta. You can see the numbers, marks again. 11, 12, 12, 12, and counter on the contrary in you can see the compare with the two columns. So you will observe that Madhya Kosta column is showing the more marks than the Mrudu and Kuru Kosta. So by keeping the just filling the parameters, you can achieve the Madhyam Kosta. Next slide, please. Next slide. Yes. So out of that, nature of the frequency and consistency of the stool, that is point number 1. Effect of taking hot milk, hot water, etc. Point number 2, and time taken for defecation, excluding the time for the newspaper, 4, are majorly deciding factors of the Madhyam Kosta. By calculating all these factors, these are the 5 factors which decide the Kosta. We found that whenever there will be the dominance of the first, second, and fourth parameter, the Kosta will be behave like a Madhya Kosta. Also, next slide. We gave the 3 or 4 tablets of Ichavedi Rasa. In our college, we generally practice Ichavedi Rasa for Virechana. We generally go for the 2 tablets, 3 tablets or 4 tablets, because Vidarbha is a dry region. Sadharan Desh is here. So, and the habits, boil habits and the diet habits are dominated by the very spicy food. So most of the people are having the tendency towards Madhya Kosta or Kuru Kosta. So we routinely use the Ichavedi in a more quantity. So we gave 3 or 4 tablets of Ichavedi in some of the patients. So next slide. This is the column in which Ichavedi. Next slide. In Mrudu Kosti people, we gave the Ichavedi, 3 tablets of Ichavedi. First table, 15 was the average Vega. Serial number, then dose is written in the first, second column. Third column is of the Vega, and fourth column is the Kosta. There are the 3 tables. I am talking about the first table. You can see the 15 was the average number of the Vega with the 3 tablets in Mrudu Kosta. 15.5 Vega were there in the second table, having the Madhya Kosta, and with the Kuru Kosta with the 3 tablets. 7 was the average number of the Vegas in the Kuru Kosta people. So whenever there will be the Kosta Krura, the tendency of getting lesser number of the Virechana is there by the 3 tablets. Next slide, please. In this slide, next slide. Here, these are the 3 tables where we used 4 tablets of the Ichavedi. In Mrudu Koshti people also, based on their habits, we decided to go for the Virechana with the 4 tablets, with taking consideration of their bala, and we found that with the 4 tablets in Mrudu Koshti people, there were the 25 Vegas. With the 4 tablets in Madhya Koshta, 2 patients were there. We got the average value of the 17 Vega, and in the 5 people of the Krur Koshta, by giving the 4 tablets of Virechana, we got the 14 Vega as an average. So here also you can see, if you increase the number of the tablets in Mrudu Koshta, the number of the Vegas are more, and in Krur Koshta also the number of the Vegas are lesser. Till though you gave the 4 tablets, the average number of the Vegas were 14 only. So this is the this we checked by both the means. Means we gave the Ichavedi Rasa after calculating the Koshta, and we found this type of behavior. So it genuinely it helps to assess the nature of the koshta and dose of the medicine also. Now Prakriti and koshta. So koshta, a lot of people think that the nature of the Prakriti has the impact on the koshta, but it's not like it is not the case, because for this thought I assess. Next slide, please. Legal and logical. Yes. Koshta is not mentioned as a parameter of assessment of the Prakriti by any text. If you go through the Prakriti Sutras in all the 3 Sanhitas, Charak, Sushruta and Vagbhata, you will never, not a single reference of the Koshta is found in all the 3 explanations of the Prakriti. So, Koshta is not the parameter to assess the Prakriti. So it might be influenced by the dosha constitution of the Prakriti, but unlike Prakriti, it may be changing due to the various factors throughout the life. So Koshta has the nature of changing. So if the patient is having Mrudu Koshta during the childhood, he may have the Krur Koshta in the Madhyabala and Krur Koshta in the later period of the life. So Koshta, depending on the desha, depending on the vaya, depending on the food habits, depending on the satmya, the nature of the koshta gets on changing. That is why the Vagbhata might have explained koshta ahead of the Prakriti in Ayushkame chapter. He first explains koshta, then explains the Prakriti. In Vagbhat Sutrasthana first chapter, the explanation of the koshta arrives first, then the reference of the Prakriti arrives. Is Koshta dependent on the Prakriti? No. Koshta is certainly influenced by dosha. Yes, definitely Koshta is influenced by the dosha, but Koshta remains Krura due to the dominance of Vata, Madhyam due to the dominance of the Kapha, and same Samadosha and Mrudu due to the dominance of Pitta. A lot of experts opine that just like Prakriti, the nature of the Koshta remains the same throughout the life and it is unchanging, but it is not the case. You can see the nature of the Prakriti. Next slide, please. Next slide, please. Yeah. In the first column, Prakriti is mentioned. There were the Vata Pitta Prakriti. 18 patients were having the Vata Pitta Prakriti, but the nature of the Koshta, 7 were from Madhya, 7 for the Mrudu, and Krura was of 4 patients of the Krura. Pitta Vata, 24 out of 24 patients, 10 patients were having the Mrudu, 8 patients were of the Madhya, and 6 patients were of the Krura. So, wherever there is a Vata, you will see the Krura column. Vata Pitta 4 patients, Pitta Vata 6 patients out of 17. Right? So 10 patients, and last one Vata Kapha. 11 patients were having the Vata component. In Pitta, in Mrudu component, out of 47 patients, 10 patients of Pitta Vata, 18 patients of Pitta Kapha, and 10 patients of the Kapha Pitta. And Madhya Koshta, Pitta Kapha 13 patients, Pitta Vata 18 patients, Kapha Pitta 7 patients, and Vata Pitta 7 patients. In Madhyam Koshta, the rule gets confirmed that Madhya Koshta may be having the different parameter, but certainly Mrudu and Krura Koshta have their dominance of respectively Pitta and Vata. Now I will talk shortly regarding the modern aspect. So next slide, composition of feces in context with the Mrudu and Krura Koshta. Koshta is assessed on the basis of the status, nature of the fluids in feces also. We have seen that Krura Koshta has solid feces while Mrudu Koshta has a liquid or more slurry feces. Normal composition of the feces is 3/4 of the water, 1/4 of the solid material, 30% out of that 30% of the dead bacteria, 10 to 12, 20% of the fats, 10 to 20% of the inorganic matter, 2 to 3% are the protein, and undigested 30% roughages. This is the general composition of the uh, feces. So in Mrudu Koshti people, the composition of the water is more, and in Krura Koshti people, composition of the solid material will be the more. Now, gastrointestinal reflex. As we have seen that it is related with the reflexes, how much strain you need for the koshta. So the gastrocolic reflex or the gastrocolic reflex is one of the number of the physiological reflexes controlling the motility, peristalsis or the gastrointestinal tract. Gastrointestinal regional reflexes go back to the sympathetic ganglia and are important reflexes at a distance, such as the gastrocolic reflex causing evacuation of the colon. It involves an increase in the motility. Next slide. Of the colon in response to the stretch to the stomach. Whenever you are putting something in the stomach, it may lead to the movement of the, it may start the peristaltic movement and it may lead the colon to evacuate faster. So, number of neuropeptides have been proposed as mediators for the of the gastrocolic reflex. These include serotonin, neurotensin, cholecystokinin, and gastrin. Now, role of the motilin. The motilin is a hormone which is secreted in the gastrointestinal tract. When in a fasting state, motilin increases in the blood, leading to the rapid peristalsis or migratory motor complex. So, various hormones are also influencing the bowel activities. So, this might be having the some impact in regard on the impact of the koshta, the secretion of the motilin, the quantity of the secretion of the motilin. If it is more in a quantity, maybe it might be making the koshta as a of the mrudu nature, and in Kuru Koshta people the quantity of the motilin might be lesser one. Now, release of the ovulation, reasons of the ovulation in laxed bowel, that is Mrudu Koshta, might be quicker than the other two types. We have seen that the Mrudu Koshta people gets the Snehana faster than the Madhya Koshta and the Krura Koshta people. The person, the quick emulsification, digestion and acceleration of the fat. Emulsification of fat is done by the lecithin, which is the component of the bile, right? So digestion of fat is generally done by the pancreatic lipase enzyme, which is present in the pancreatic juice. The bile salt micelles act as a transport medium to carry the monoglycerides and fatty acids to the intestinal epithelial cells for their absorption. So digestion and absorption of the fats and emulsification of the fat is is being faster in these Mrudu Koshta people. Why it might be there? So the Tikshna property of the Pitta might be acting in those on those receptors, and which might be responsible for increasing the neuronal response of the GIT, leading to the increase in its secretion, absorption, and motility. So even when the pitta is dominant, that is in Mrudu Koshta, the functions of the liver, duodenum, and pancreas may be increased or the quickened, and this which may lead to the increase in the production and the function of the bile acid, leading to the early and quick emulsification of the fats and also pancreatic lipase, which further leads to the early digestion. This further suggests that the ability of the emulsification, digestion, and absorption of fat molecules might be slower in the people with the costive bowel. So the nature of the koshta is influenced by the pitta, and whenever the pitta is there, it will affect the secretion of the enzymes, hormones, acids, and alkalis more in the in that area, and which may fasten the snehana process. So in Mrudu Koshta people, snehana might be faster than the Krura Koshta people. Next slide. Reasons how patient with the lax bowel, that is the Mrudu Koshta, might be showing quicker reaction to the purgatives. Second thing which is told about the Mrudu Koshta people, that they show the fast reaction to the purgatives. What might be happening? There are the three factors: hydrophilic or the osmotic action, which retains the water and electrolytes in the intestinal lumen and increase the volume of the colonic content and makes it easy to propel. Second thing, acting on the intestinal mucosa, decreased net absorption of the water and electrolytes. Intestinal transit is enhanced indirectly by the fluid bulk. Whenever you increase the water content in the intestine and you decrease the absorption of the water and electrolytes from the intestine, it increases the fluid bulk and it uh, helps in intestinal transit and increasing the propulsive activity by as a primary action, allowing the laser time for absorption of the salt and water as a secondary intake. So whenever when the purgation are administered in the laxed bowel, in the Mrudu Koshta, Ushna and Tikshna properties of the Pitta might be helping in the intestinal mucosa to increase the propulsive activity, allowing laser time for the absorption of the salt and water. Ushna, Tikshna, and Drava properties of Pitta might be helping in the process of osmosis, helping in increasing the volume of the colonic content. Sara property of the Pitta might be reason for making it easier to propel the feces further. And the last point, reasons how increased kapha in Koshta might be causing Dukkha Virechana and reduced kapha cause the Sukha Virechana. Okay, so quantity of kapha, if the kapha is more, the Virechana will be Dukkha Karak, and if kapha is lesser, Virechana will be easier. Passage of the feces will be easier in lesser kapha condition. What might be the reason? So first one, kapha through manda and sthira properties may influence the cranial parasympathetic innervations supplied from the esophagus till the first part of the large intestine, which deals with the stimulation of the two plexuses, the sphincteric plexus and Meniere's plexus. These properties, which sthira and manda properties, might be leading to the slowness of the neuronal activity of the meyenteric plexus, leading to the decreased tonic contraction or tone of the gut wall, decreased intensity of the rhythmic contraction, slightly decrease the rate of the rhythm of the contractions, and decrease the velocity of the conduction of excitatory waves along with the gut wall, causing more or less peristaltic movements. These properties may also lower the activity of the Meniere's plexus, helping in controlling local intestinal secretions, local absorption, local contraction of the submucosal muscles. Hence, this leads to a slowness in purgation activity or less purgation activity. So, Manda and Sira properties of kapha might be influencing the nerves, the plexuses, which affect the contraction or the peristaltic movements of the intestine, number one, and number two, the secretions. Both things might be resulting in the slowness of the purgation. So whenever there will be the more kapha, that means sthira and manda properties are more in the intestinal area, purgation or the defecation will be the slower than the other two kostas. So kosta is the entity describing expression of the bowel. It changes as per the food habits, bowel habits, age, geographical region, season, etc. These factors are to be taken into consideration while assessing the kosta during any panchakarma procedure. So now concluding this session, Prakriti is unchangeable, but kosta is not. So kosta is always changing. It is continuously changing throughout the life. So one should assess the current status of the kosta routinely before deciding the panchakarma protocol. The dosha constitution situated in Grahani decides the nature of the bowel, which ultimately influences the nature of the feces, that is hard, semi-solid or watery. Kosta represents the functional ability of the gastrointestinal system. Hence, it can be said that the functional aspect of the kosta is explained on the basis of the expression of the one's bowel habit. So this is the conclusion of my session. Thank you very much. I again thank Dr. Rajkala Patil Madam, HOD, Department of Panchakarma, BHU, for inviting me and sharing my thoughts regarding the Kosta in front of you all. Thank you very much. Thank you, ma'am.
Thank you, sir. Thank you so much on behalf of Department of Panchakarma. I really thank you for elaborating such a concept of Kosta in the purview of Panchakarma, like modern aspect of Kosta, how to give in different, how to assess it. You have shown the data of 101 patients. Of course, it will be very useful for our students. They are so happy to listen you. Thank you, sir. Thank you.
Thank you
for taking a time from your busy schedule and giving us your valuable time, precious time for the Panchakarma. Thank you, sir. If any questions are there, they can ask.
Thank you.
who have, yeah, I thank you to all who have joined online to this session. They can raise their hand if anybody is having any question. We can unmute and they can ask direct question.
Thank you so much, sir, for the excellent presentation. I have
Thank you,
few
ma'am.
questions, sir. So, so as you said, that the doshas, they can the koshta changes, as per age and many other different factors. So, in day-to-day life also, the doshas change in the morning, in the day, and in the evening with the change of change of the position of the sun and many other factors. So, uh,
Yeah.
in the morning, so why doesn't it change? Like in the morning, because it is more of a kapha dominant. So it should be, more of, how do I put this? Um, so it should be towards, madhyam koshta, and in the daytime it should be, because it is a
Uh,
pitta dominance in the daytime, so it should be, towards the mridu koshta, but that doesn't happen, sir.
okay. I will explain this in a two-way. I will explain it in a two-way. Okay. As we see that grahani koshtastha agnadishtan abhibhuta. As we have seen earlier, one reference was there that grahani is said to be the koshtastha agnadishtan bhuta. Right? Whatever you are saying, that is true in every for every biological factor. Am I right? This is grahani koshtastha
Yes, sir.
agnadishtan bhuta nadi. It is said like that. Grahani is the nadi which is present inside the koshta and which is the sthan of the agni. Right? Regarding the nature of the koshta, you see whenever the koshta in the afternoon, there will be a lot of secretions in the afternoon, and which will help in digesting the things in a faster way. Right? The assessment of koshta is not related with the related with the other factors. Means if agni is good, then koshta should be the pitta dominant. Koshta will be the pitta dominant, or the nature of the koshta will automatically become the say mrudu. It is not like that. The terms mrudu, madhyam, and koshta, krura, are very particular. They are indicating the overall nature of the vowels. So we are routinely not going for the whole day towards the vowels. सो द नेचर कोष्टक की बात ही नहीं है ऐसी कि जो 12 घंटे के लिए या 24 घंटे में हर 3-3 घंटे में बदलना एक्सपेक्टेड है. द डेफिनेशन और द नेचर ऑफ द कोष्टक के लिए जितने भी पैरामीटर्स दिए गए हैं, all are nothing is indicated on the day-to-day behavioral changes. Number 1. Number 2, आप कोष्टक को भी अगर देखोगे आप तो सुबह के वक्त कोष्टक की जो मोटिलिटी स्टार्ट होती है, that starts in a vata kala, early in the morning. Though अगर जिसको मृदु कोष्ठी, the sensitive koshta, the people who are having the sensitive koshta, they got the urge early in the morning during the vata kala only. So the stimulation towards the koshta, stimulation for the bowel starts from the vata only. So accordingly, even diurnal in variations also, vata stimulates koshta and it allows the passage. So the nature of the koshta is not related, which is to be changed in every 3 hours or in every 6 hours. उसके बारे में वैसे कहा ही नहीं गया है. So we cannot put the other rules in every context. उस हिसाब से वय के बारे में, whenever you are watching the dosha dominance as per वय, what we say, वृद्ध काल में वात डोमिनेंस होता है और अर्लियर एजेस में कफ डोमिनेंस होता है. तो वह एज के हिसाब से भी दोष डोमिनेंस बदलता है, दिन के हिसाब से भी दोष डोमिनेंस बदलता है. यू हैव टू थिंक द कॉन्टेक्स्ट. आपको कॉन्टेक्स्ट ध्यान में रखना है, किस कॉन्टेक्स्ट में आप बात कर रही है. दैट्स व्हाई इट इज नॉट लाइक दैट.
That is वयो रात्रि भुक्तानां ते अंत मध्याधिका क्रमात्.
वयोरात्रि भुगतान तेन मध्यतिका क्रमात्. राइट.
That is only for the like a diurnal variation of dosha sthiti. Isn't it, sir? I think that is not like it is not directly related with our kosha. That is mucosal lining of the every individual will not change.
Is it different? Yes.
So they
even that is very true, ma'am. Very true. The acid number, the quantity of the acid secretion, the quantity of the mucoid secretions, the quantity of the enzymes, the quantity of the hormones, the velocity of the muscles or motility of the muscles varies from the patient to patient. उसमें हर चीज में हर वक्त चेंज होते रहता है. That's why the koshta is changing by the food habits also. Slowly, means if you are staying in Varanasi, the water, food, and all the factors of the Varanasi will influence your koshta. And if you move to the Vidarbha region, after say 6 months or Satmyata bhav, you are moving to the desert region. Say you are moving Jaisalmer, your koshta might behave in a different way. So koshta and all the biological factors gets influenced by a lot of factors, and depending on that, your koshta will behave.
Yeah, because I was there in PG Trivandrum and PhD in Jamnagar and practice a research officer in Delhi. The same thing happened. In Kerala, we use the Avipattikar Churna 30 gram or 25 gram for the Virechana, and patient will go 15-20 times. But in Gujarat, it was like we use 80 gram or 80 or 100 gram of Trivruttavaleha, and patient will purgate only 20 times or 25 times. But that was different in Delhi. So Deshakal, that's why in Panchakarma, the Acharyas have told Samiksha Dosha Aushadha Deshakal. So the dosha and desha, you have to see in all the aspects of Panchakarma. But I don't think what the question of Ramita is there. I don't think there is a change in the koshtha with the diurnal variations. No, it is not. That might be the change in the Agni, that might be the change in the dosha, but I don't think there is a change in the koshtha. Okay.
कोष्ठ बदलने के लिए काफी एक वक्त देना पड़ता है. उसका कॉन्टेक्स्ट है ही नहीं डायरनल वेरिएशंस के लिए. उसकी कॉन्टेक्स्ट ही नहीं है. उसका कॉन्टेक्स्ट ही नहीं था डायरनल वेरिएशंस के लिए.
Yeah. It was not in the context of diurnal variation. The Koshta is having its own assessment criteria. Like you can have the past history of the Koshta and you can take the therapeutic assessment of the Koshta with what you are giving the milk or Triphala. With that you can confirm it. Or with Snehapana you can confirm it. Like duration of Snehapana. But Koshta anyway you have to assess on the history of the bowel habit and all this what sir has told. That is actually the ideal way of assessing the Koshta. Okay, sir. Thank you so much. If anybody is having question, they can raise their hand. Otherwise, we'll close the session. है किसी का? है? इतना क्लियरली बता दिया कि हमारे बच्चे सब समझ गए हैं. Now they are going to assess the cost of each and every patient, sir. Thank you, sir. Thank you so much.
Thank you.
On behalf of the Department of Panchakarma, Faculty of Ayurveda, IMS, I thank you for giving such a valuable insights for the Koshta assessment. Thank you, sir. Thank you all who have joined online.
Thank you.
Thank you, sir.
Thank you.